Good evening, everyone. It's Dr. Jennifer Freiheit here from the Kenosha County Division of Health on May 27th. It's been a glorious couple of days with the sun and the heat, and it certainly does a lot to improve our spirits, doesn't it? Today, at the end of the day, we sat at 1,084 positive cases. That is a 65 case increase from yesterday at this time, and it's our single highest day of positives outside of an outbreak testing situation. We have currently 25 deaths, 23 hospitalizations, and 4 of those are on ventilators. Our numbers are not going down. We are still seeing increases in our percent positive rate. We're starting to see an increase in our R factor, which is what basically predicts our projection modeling. And we're still one of a dozen states in the country that is seeing an increase in cases. Many other states in the country are either stable or seeing a decline in cases, but Wisconsin is not one of them. And especially within Wisconsin, Racine and Kenosha counties is still on a great increase. In fact, I was talking to several other health officers in southeastern Wisconsin today who all saw a big increase today alone. Could that just be catch up from a long weekend? We certainly all hope. Or is this the start of the increase that we were projecting after the safer at home was lifted? I certainly hope that we're proven wrong, and I hope that it doesn't continue on the trend like we saw today, but we're still in the thick of this. We have great contact tracing needs that we still need the community to be compliant with. We need individuals to assist us when we call to give your test results and tell you that you're positive. We want to know all of the places that you have been, all of the people in your household that you live with and how they're feeling. This is all part of this disease investigation process, and this helps us to contain a virus such as COVID-19. So we're hoping that people will continue to be compliant. Each one of the public health nurses that is on our disease investigation team is starting to meet some resistance with people that they call, telling them that they're positive. These are all people that would have been compliant just a couple weeks ago. So we are starting to see people that maybe aren't as sharing as much of their information or letting us know who their household members are or if they're sick. And we desperately need this information in order to educate, help people get better, put people in isolation and quarantine in order so that we don't continue to spread it throughout the community. And we also need our businesses to assist being compliant. The grand majority of the businesses in Kenosha County have been amazing, have reached out to us to help review their guidance or have us visit their facilities, and have really taken to heart the public health guidance and the recommendations we've put out there. But we still need businesses to help and be compliant because the virus is still out there and it's still growing and spreading throughout Kenosha County and southeastern Wisconsin. In fact, the CDC just came out with new guidance that our state health department is recommending. When we would test somebody or would investigate somebody, we would take the first day of their symptoms and then go backwards 2 days, meaning somebody could spread the virus 2 days before their own symptoms ever even showed up. New guidance from the CDC in the state is telling us to now go back 10 days, that somebody could be spreading this 10 days before their own symptoms even show, or 10 days before they got their test if they're asymptomatic. So the compliance that we need from the public is for something that you all could do is to keep your calendar and to keep the contacts you've had each day. For if the health department calls you, we will say 10 days back from the first sign of symptoms, where were you? Who did you come in contact with? We would like those names and phone numbers. We will not share your data, that's protected health information, but we will call those close contacts to say, for example, last Friday, you were in close contact with a positive case. We are now recommending you quarantine for 14 days from that date of exposure to the positive. So all of this changing guidance is really changing the contact tracing game for us. It's going to require a lot more work on public health's part and a lot more work on the public to be able to feed us the data that we need to know so that we can contain the virus. So to really keep track of the places you've been, the errands you've run, the people you have visited with, your close contacts, and that means people that you have been within 6 feet of for longer than 10 minutes. So passing by somebody on a trail or passing by somebody in the grocery store is not what we consider a close contact. It's somebody that you have spoken to, been within 6 feet for longer than 10 minutes. And that is who we will be asking about as far as who are your close contacts. So we hope to get continued compliance that way. Our testing strategy in Kenosha County has really picked up. We're excited to say there are many different venues for testing now, and it is helping us to meet our original testing goal. And we continue to look to meet this for the long term, as testing will need to happen until a vaccine is available, and then it will continue to happen much like beyond a vaccine, much like we do for strep throat testing. When you go to an urgent care, for example, and you get tested for strep throat, COVID testing will always continue in some sort of fashion through your providers. But we need to keep the community-based testing strategy alive until the vaccine is available. Aurora is now testing starting this week with 2 lanes as a community testing site. CVS on 57th will start testing on Friday. The Kenosha Community Health Center and Freiheit South are still continuing their testing campaign. Kroger, while it will end at the end of this week, the Kroger Health testing site in Kenosha County, it will hopefully be back sometime in mid-June. We're working on that. And next week, we will have the National Guard out at Central in Westosha to do a broad community testing site from June 1st through June 6th. This will be for anybody who is symptomatic or asymptomatic, anybody who lives or works in Wisconsin. So it doesn't have to be a Wisconsin resident, doesn't even have to be a Kenosha County resident. So it's a broad open testing site on a first come, first served basis. So there are many, many venues to have testing now. This is very good for public health because it provides us the data we need to still be able to control this. So more testing, more data, the faster we can box this virus in. This week has also presented a lot of laboratory issues. While there are many labs that are now testing for COVID-19, with the testing that has increased, it has put a strain on our lab system. So we have been receiving results 6 to 7 days out. So we asked for the public's patience when just last week we were able to say that testing results were coming back in 24 to 48 hours, and it's now taking a little bit longer to get test results back. I know this presents a hardship for people that are waiting on those results so that they can go back to work, or maybe they need a work release letter. So we're working as best as we can to be able to get those labs and call these positives as quickly as possible and educate and allow people the information they need to know for isolation and quarantine. So just please be aware of that. I think within a couple of weeks, we'll get back down to that 24 and 48 hours. Just right now with the increase in testing, laboratory systems are a bit overwhelmed. Also, in other news this week, our Board of Health has been very active. The Health Department does have a Board of Health. It's an advisory board that has put out a letter this week with all of our healthcare system partners to basically state that the virus is still here and we still need to remain ever vigilant. We had 2 vacancies on our Board of Health that we are filling next month, so we're very excited to have the increased participation with our Board of Health. Today, we also just finalized and put out the Kenosha County Kickstart Plan. We're very excited about. It gives all of the details and the guidance that businesses need in order to quickly operationalize and implement safety measures within their business. And we have received wonderful feedback about that, and we can't thank CABA and all of the business partners in the different business sectors enough for all of the work they put into this and to help coordination with public health. Our gating criteria is something that I did receive a question on that I wanted to just clarify. When the Badger Bounce Back Plan was put out, it was stated that when a county hit certain gating criteria, there's 6 different measures, they're on our County Hub website. When we achieved those 6 measures, we would move into phase 1. It's a little bit confused now that the fact that the Safer at Home order was lifted early. Kenosha County has still only achieved 2 of the 6 gating criteria measures, as you will see on the website. So technically, we are not in phase 1. However, with the opening of businesses, this is the phase that we are putting out recommendations for, putting out guidelines and best practices for, in hopes that all businesses will comply with that Kenosha County Kickstart recommendations to help protect their workforce, their staff, and their customers. Today we also had a tour, a very thorough tour that Amazon was gracious to give us. We had a thorough tour through MKE1 facility. There are 2 different facilities at Amazon in Kenosha County. And quite honestly, we were very pleased with the results that we saw. They are doing all of the right things, requiring masks for all employees. We saw everyone complying with proper mask wearing over the nose, not under the nose. Social distancing, they put in several measures. Break room separation, very unique out-of-the-box thinking in order to keep their employees safe. So we are very pleased. We're still working on a testing strategy. They themselves as well for all of their Amazon facilities across the country are working on that testing strategy. We definitely from a public health perspective would like to see a more rapid testing strategy as soon as possible, that we are continuing that dialogue after our visit with them today. We are seeing several facility outbreaks. And again, from several weeks ago, by definition of an outbreak with the state health department, 2 or more positive cases within a building or a workplace is considered an outbreak. So we do have several outbreaks that we are still monitoring. We're helping to contain and control. And certainly when facilities are working with us, we're able to get all of their information, contact all of their employees, and really help them with any media messaging or any compliance issues as far as sanitation, disinfection, masking, social distancing, all of that to contain those outbreaks and pretty much snuff it out at their facilities. Since the Safer at Home has been opened back up, for example, today alone, we saw several dining and drinking establishments that had 7 positive cases. So these are employees of these dining and drinking establishments that are positive. And this is sort of the scenario that public health was afraid of. If you have one bartender that maybe came in touch with 300 people on a night shift, those are 300 people that we would like to contact trace. It's very difficult, obviously, to be able to get a list of all 300 people that visited that particular establishment that night. So this is where we have to do some serious education within the county to sort of say, we need to ensure that employees are wearing masks, that they're social distancing in these establishments, that the virus is still here, and we very much want to help control and contain it. So my message for tonight is really to just implore Kenosha County residents that this is not business as usual. We still are very much on the rise. We still very much have a virus to contend with, and we don't want to overwhelm our public health and our hospital systems. Hoping again that today was just an anomaly after the long weekend. But we implore everyone to wear a mask when out in public, when running errands, going to various stores, visiting certain places, visiting family or friends. We still implore people to limit their contacts and to remain as distant as possible from others. We do not recommend gatherings over 10 people. Any large or mass gatherings are where we see the biggest spread of COVID-19. I do want to remind everyone, we have 2 email addresses that if you have any questions or need any further guidance from the health department, we are here to assist and to help. If you are a business, you could email kickstart@kenoshacounty.org, and that will assure that our business team is able to respond to you quickly and that we're able to help you in whatever fashion you may need or any ideas that you may have. Once again, this is for businesses. This is kickstart@kenoshacounty.org. We also have a general COVID-19@kenoshacounty.org email address. This is a way as well to reach our health department or any of our other partners that we're filtering these emails through. And we are maintaining 100% response for these emails. And once again, for the general populace, that is COVID-19, no dash, no space, COVID-19@kenoshacounty.org. And this is how, if you have any ideas or suggestions, we certainly, as I've mentioned in the past, one of our critical missions is education. We certainly want to still educate our public as much as possible, let people know what they can do to protect themselves, and let them know the data with as much transparency as we possibly can, and how we want to keep Kenosha County safe. So any ideas that you have as well, we're open to that as far as how to educate, how to get our videos and our messages out. All testing Facility information, open times, how to get an appointment, all of that will always be posted to our Kenosha County Health Facebook page, as well as the County Hub website and several other Facebook pages. We make sure that our Kenosha County Health Facebook page is updated with all of that testing information and any new press releases or any information as well that we're putting out. So I'm going to check just one more moment to see if I have any questions that popped up throughout the time of the call, and I see that I have no new questions. So lots of activity going on this week. Thank you all for being safe and keeping the residents safe through your own actions, through wearing a mask and remaining distanced. And we look forward to talking to you again next week. Thank you.